Welcome to AETCM, the emergency medicine channel. Today let us discuss about dengue fever, one of the common mosquito-borne diseases in our country. It's caused by 4 distinct serotypes dengue virus. It's a single-stranded RNA virus. It is in the genus flavivirus. Infection by one serotype may result lifelong immunity to that serotype, but no to others. That's why we are seeing repeated dengue infections in patients, many patients. Other hemorrhagic fevers are Lassa fever, Marburg fever, Ebola virus, yellow fever, Crimean Congo virus, Handan fever. In that Handan fever is there in our country. Other viruses are not well known in our country. We may not be knowing. It may be there, but it is not proven that these viruses are not common in India. But Handan virus is reported in some parts, but it's also very difficult to diagnose because routine investigations we do not have for such viruses. But dengue investigations are very commonly available in our country. That's why in our country dengue virus is very common. Dengue fever is otherwise called as break-bone fever. Those who have experienced dengue fever, they know that severe bone pain is the characteristic feature, especially back pain. Many patients tell that they have severe back pain during this fever. All viral fevers you can have myalgia, arthralgia and all, but this pain is very severe. That's why it is called as break-bone fever. It's a flavivirus. Vector is mosquito. Aedes aegypti mosquito. You can see the tiger mosquito here. This breeds in fresh water. That is a problem. Whenever rain comes, immediately after the dengue episodes will come up. So good water is needed for the multiplication of this virus or this mosquito. This multiplication of this mosquito. So during that season, you get more dengue incidences. Incubation period is 2 to 7 days. Now it's like any other fever. You get myalgia, severe arthralgia, back pain, tenderness in the muscles. All these things are there. The fever is typically saddle back type of fever. So it's a biphasic fever. There is a break in between 4th and 5th day. Then another episode comes last 2 days. Then fever subsides. Severe headache, sweating, palpitation, joint pains, back pains, all these things are very common. Eye congestion and redness is seen in many patients. That's why it resembles even leptospirosis. Leptospira also will have all these clinical findings. Relative bradycardia can be there in many patients. Lymphadenopathy is not classical, but some patients you can see lymphadenopathy. Rash is seen in first 2 days. Maculopapular scarlet rashes are seen in many patients, but this is not a typical feature. Again, many patients come with only fever, some diarrhea, all these things, but they may not have any rashes. But classical textbook symptom is rash. Now, WHO is classified into grades of dengue. Grade 1 fever, body pain, myalgia, constitutional symptoms, positive tourniquet test. Nowadays we are not doing this test because everywhere platelet count is available. So immediately if you ask platelet count within 1 or 2 hours you get platelet count. If you are not getting a platelet count in time, then you can go for this tourniquet test. Spontaneous bleeding occurs mainly because of low platelets. Spontaneous bleeding with circulatory failure. Circulatory failure is due to vascular leak. Hypotension can produce. Severe shock is the grade 4 dengue. And one of the symptoms which is not explained in classical textbooks in dengue is severe diarrhea. Many patients who is having dengue present with abdominal pain and diarrhea. This is not explained in many textbooks, but if you follow up dengue cases in our country, in India, many of these patients have this unusual symptom. They have diarrhea. Diarrhea is a prominent feature in dengue in many of our patients. But all other features like severe bone pain, thrombocytopenia, bleeding tendency, hypotension, shock, everything is explained. But diarrhea somehow it may not be there in the previous era, but nowadays whatever dengue cases we are getting, many of them have history of diarrhea, abdominal pain, all these things. Now, clinical definition, we should always think that probable diarrhea, warning signs in dengue, all these things are very important, but these things when we practice, we see every day. But there are some few important definition we have to see, that is, one is severe dengue. Severe dengue means there is plasma leakage due to vascular endothelial damage. This can lead to multi-organ dysfunction, and that itself can produce dengue shock syndrome also. So severe dengue is not like routine dengue fever. If you see dengue fever, normally they have fever, they have some mild elevation in the liver enzymes, they have some diarrhea, they have some back pain. Most of them recover without any problem. Some thrombocytopenia occurs within 1 week, it return back to normal. But some patients, you can see initially itself there will be hypotension. Any fever you can get hypotension because of the volume loss. Because of high fever, patient will be losing large amount of water from the body. But in dengue shock syndrome, the vascular leak is the cause for hypotension. So even if you give fluids, again the volume will be displaced from the intravascular compartment to extravascular compartment because of this vascular leak. So dengue shock syndrome or severe dengue is very, very important when we are practicing, because so these type of patients mortality is very high. Hemorrhagic fever means it is mainly, we know that it is mainly due to thrombocytopenia. Thrombocytopenia and vascular leak, both are there. Vascular leak is a primary problem in dengue shock syndrome. It will be associated with thrombocytopenia. So many patients who is having dengue, you can see platelet count may be dropping from 1 lakh is the normal, 1,50,000 is the normal, but less than 1 lakh we call it as thrombocytopenia. It may drop to 50,000, it may drop to 40, 30, 20 like that. But most of these patients may not require platelet transfusion. They because the drop will be every day 10,000 like that. Normally routinely we are seeing drop will be around 10,000 in a day. So by 7th day or 8th day, platelet may drop up to 10,000 or 20,000. Then immediately it will return back. The platelet production is very fast. Once the patient recovers from dengue, within another 1 week it will become normal. So the requirement for platelet transfusion is not very, very common in patients who is having dengue, but only if there is a significant bleeding or impending bleeding or a rapid drop less than 10,000. All these things we need to transfuse with platelets. Now, one important problem in dengue that we all should remember, that is the vascular endothelial damage and vascular leak. That is a major problem for dengue shock syndrome. It can be an immune mediated or it can be a toxin mediated. So there are a lot of theories regarding this. But some patients who is having dengue, they developed vascular leak. It's a cytokine NS1 dengue virus induced problem. So multiple theories are there. Whatever it is, ultimately that will produce vascular leak and intravascular collapse. Now, expanded dengue syndrome is a definition for multi-organ dysfunction. So patient who is having dengue fever, they also can have neurological, hepatic, renal and other organ involvement. This is common in many infections like leptospirosis. We call it as wheel syndrome. Here multi-organ dysfunction syndrome in dengue, we call it as expanded dengue syndrome. So here patient can have neurological manifestation, gastrointestinal manifestation, cardiac manifestation, ARDS, all these things. But these incidences are not very common. Now, once you suspect dengue fever, we can do NS1 antigen. NS1 antigen or protein, non-structural protein 1, that is during first week itself it will be positive. Otherwise you can go for RT-PCR. It will be positive during the first 5 days of illness. Dengue IgM, it's an antibody the production of antibody for any disease, it takes time. That's why all these antibody tests will be positive only in the second week of the disease. In dengue fever, IgM antibody production will be only after the acute illness. So getting a positive test after 5 to 7 days is not at all clinically helpful. That's why many of the time we use NS1, because NS1 is the first investigation and which is available everywhere. That will be positive in dengue. And remember, we have to always look for other serious problems like malaria, leptospirosis. That investigation also should be done in acute phase, because malaria have similar presentation, leptospirosis has similar presentation, but both have definitive treatment. Malaria, leptospirosis and all have definitive treatment. Dengue, there is no definitive treatment, so only supportive treatment is available. But it is basically to rule out other very serious conditions like leptospirosis and malaria in dengue fever. That is very, very important. Blood investigation produces thrombocytopenia. That is a classical problem in dengue fever. Leukopenia, SGOT, SGPT will be elevated in hundreds, 200, 300, that is a normal range. Hyperbilirubinemia, mild hyperbilirubinemia is seen. Elevated creatinine, not very high. Dengue as such will not produce renal failure. In the second phase of dengue or expanded dengue syndrome, you may get, or vascular leak hypotension may produce pre-renal kidney failure. Now IgM, IgG tests are very important, but we should always remember that IgM can be also positive in chikungunya, IgG can be positive in chronic phase of dengue, CMV, chikungunya, varicella, Epstein-Barr virus, all these things IgM, IgG will be positive. So nowadays IgM, IgG has got less value comparing with NS1 antigen in dengue diagnosis, but in some centers only IgM and IgG will be available. So IgM indicates acute infection, IgG indicates slightly old infection. So it's a saddleback type of fever. You can see the saddleback in the temperature chart. Severe dehydration, bleeding tendency, shock, multi-organ dysfunction. Hematocrit values will be high during acute phase of dehydration. Then it will become normal. Platelets will be dropped in acute phase, then it will become normal. Viremia, acutely it will be high, NS1 antigen will be positive during that period. Second phase, antibodies will be positive, IgM will be positive, then IgG will persist. So when we are managing dengue fever, the most important will be IV fluids. Whether the patient is in shock or not, we have to give IV fluids, because we should know that high degree fever, patient will be losing large amount of volume. Patient may have diarrhea, patient may not be taking proper diet or fluid. So normal saline or plasmalite or ringer lactate, any of these crystalloids can be given. If the patient is not taking adequate oral feeds, then DNS also can be given. Next one is thrombocytopenia management. Thrombocytopenia, normally we don't give platelet for every patient. If there is a significant bleeding, then you give platelet transfusion. Otherwise, some levels only will transfuse. In patients who is having dengue shock syndrome, you have to give fluids like 30 ml per kg body weight, either ringer lactate, normal saline or plasmalite can be given. Continuous infusion of fluid can be given depending on the urine output. One of the most important response for the IV fluid is urine output. If there is a good urine output, your fluid challenge is good. Platelet transfusion should be done in patients who is having thrombocytopenia. The indication for that is normally if the platelet count is less than 10,000, we try to transfuse. Otherwise, at any count, if there is a bleeding tendency, we transfuse. Or if you want to do a procedure, you have to keep platelet count above 50,000. If you want to do a neurosurgical procedure, the platelet count has to be above 1 lakh. Like that, we can transfuse platelets. Otherwise, platelet transfusion will not be a treatment for dengue disease, because if you normally in our body, platelets will live for only 7 days. Normally, our own platelets will live in our blood for 7 days. But a transfused platelet, which is taken from other person's body, will only live for 24 hours. So a prophylactic transfusion of platelet have no role in any of the thrombocytopenic condition. Only if you want to treat a bleeding tendency and if you want to prevent a bleeding in acutely, you can give platelet transfusion. Each unit should transfuse in 5 to 10 minutes. That is also very important. Usual dose is 1 unit per 100 kg body weight. Suppose it's a 70 kg male patient who is having dengue and platelet count is only 5000. You have to give 7 units of platelet transfusion. So each unit should be given over 10 minutes. So that is very important. If transfusion is delayed, shake the bag constantly to avoid platelet aggregation. So that is also very important. So there are 2 types of platelets available in blood bag. That is, one is pooled platelet taken from different donors or 5 donors in each bag. 5 donor platelet will be there. Single donor platelet means only single platelet, single donors platelet will be in one bag. The advantage is when we are giving multi-donor platelets, there will be antibodies formed against all these 5 types of platelets. Single donor means antibodies will be formed against only one type of platelet. But in a condition like dengue and all, no need to worry. You can give multi-donor platelets. Whereas in ITP and all, we are repeatedly transfusing. Try to restrict the donors number so that different antibody production will be reduced. Otherwise, multi-donor platelets are very good. Multi-donor platelet advantage is it's less costly. Single donor is very costly. So in dengue fever, at least no need to give single donor platelet. You can give multi-donor platelet itself. Now, dengue vaccine was licensed in many countries. So we have to try whether it is available in our center. So that can be tried. If it is available, that can be tried. So we have discussed about one important infectious condition, that is dengue fever. Most of the patients, dengue fever is a safe disease because they have a fever like any other viral fever. They have severe muscle pain, back pain. You require to give only paracetamol. Some patients with hypotension, you need to give IV fluids. Some patients who is having dengue shock syndrome, high levels of fluid requirement they can have. So give 30 ml per kg body weight IV fluids. Some of these patients may also require albumin because vascular leak will produce significant hypoalbuminemia. There is no need of any antibiotic for dengue fever because it's a virus. So no need of any antibiotic, no need of any antiviral. Platelet transfusion should be restricted to only if the patient is having spontaneous bleeding or if the patient is having platelet count acutely dropping less than 10,000, or you want to do a procedure like you want to do an LP, central line, you may have to give some platelets. Otherwise, if there is a major surgical procedure, like somebody is having dengue with a neurological problem like intracranial hemorrhage, you want to do a procedure, then you have to give platelet transfusion. Otherwise, platelet transfusion should never be given as a prophylactic program in dengue fever, because the transfused platelet will not survive in our body more than 24 hours. Even if it survives, the amount will be very, very low. So if needed, you give platelet. If don't need, don't give. Prophylactic transfusion has no role in dengue fever. And there are a lot of other preparations available, lot of leaf preparations available for thrombocytopenia. All these things are maybe they may work, we don't know, but they all are not required actually. Just leave the patient. They will come back with normal platelets in 1 week. Very rarely we need to treat this type of thrombocytopenia in our clinical practice. Thank you.